is Ian Bodford.
And Liang Lu.
And welcome back to the Clinical Correlation.
Today's case is
Under the sea. Under the sea.
This is a 23-year-old male with no significant past medical history who presents with right shoulder pain since he woke up this morning. He denies any trauma to the shoulder or any issues with it in the past.
Of note, he has already been to 2 urgent care centers earlier in the day. He was sent home from both with pain medications and no diagnosis.
His vital signs are essentially unremarkable. On exam, his right shoulder has full range of motion. His distal pulses are intact. He has full sensation in all nerve distributions of the right upper extremity. He has no bony tenderness in the shoulder.
Basic labs and a right shoulder x-ray are ordered.
The labs return as normal, and the right shoulder x-ray is read as normal.
Through further history taking, you find out that the patient is a novice scuba diver and has just returned from a trip where he has been diving for several days.
You remember something about injuries from scuba diving from your in-service exam. But now what?
Although a fun hobby, scuba diving has many risks associated with it. Several categories of problems can arise, including environmental exposure problems, dysbarism, breathing gas-related problems, and hazardous marine life.
Environmental exposures include things like motion sickness, hypothermia, and sunburn. We will focus mostly on dysbarism and breathing gas-related problems.
A little chemistry for you to start off. Pressure is force per unit area. The pressure of air at sea level is 1 atmosphere. Due to the density of water being much higher than air, large changes in pressure occur with small fluctuations of depth.
Body tissues are composed mostly of water, which is not very compressible. Gases are compressible. Therefore, gas-filled organs are directly affected.
First, we will talk about the barotrauma of descent. This is known as squeeze in diving jargon. Gas pressure in air-filled spaces of the body is normally in equilibrium with the environment. However, if something is obstructing gas exchange, pressure equalization cannot happen. The ears and sinuses are most likely to be affected.
3 parts of the ear can be affected. The external canal, called barotitis externa, the middle ear, called barotitis media, and the inner ear. Barotitis media is by far the most common. The pain from descent typically causes the diver to abort the dive, but if not, it can lead to eardrum rupture.
Treatment involves abstinence from diving until symptoms resolve and decongestants. If there is a tympanic membrane rupture, antibiotics should be used.
Inner ear injuries present with a classic triad of tinnitus, vertigo, and deafness. These patients should be treated with bed rest, avoidance of strain, and symptomatic relief with anti-dizziness medications.
Any of the paranasal sinuses can be affected, but the maxillary and frontal sinuses are the most common. Treatment is similar to middle ear barotrauma. If the frontal sinus is involved, antibiotics are recommended.
Finally, face mask squeeze can occur. If a diver fails to exhale into the mask during descent, erythema, ecchymosis, and petechia can occur. The eyes can also be involved, resulting in subconjunctival hemorrhage.
Barotrauma of ascent is essentially the opposite of squeeze. According to Boyle's law, as pressure decreases during the ascent, the volume of the gas increases. This affects 3 areas of the body.
Although rare and usually self-limited, teeth can be affected. This is known as barodontalgia. The GI tract can also be affected. The intraluminal gas expands, causing a colicky pain. This is also self-limited due to the ease of passing gas.
Finally, the most serious type of ascent injury is pulmonary barotrauma, commonly referred to as burst lung. The compressed gas of the lungs expand during ascent and can rupture the lung and dissect into the surrounding tissues. Pneumomediastinum and subcutaneous emphysema are the most common forms.
Pneumothorax from this is exceedingly rare, but is especially serious because intrapleural gas cannot be released and quickly leads to tension pneumothorax.
The most feared complication of burst lung is an air embolism. This is one of the major causes of death in divers. It is caused by rupture of the pulmonary veins. The air enters the vasculature and lodges in distal small arteries. Symptoms are dependent on the location of the emboli.
Cardiac arrest can occur from emboli in the coronary arteries. However, the brain is the most commonly affected organ and presents as an acute stroke. The diver can also have sudden loss of consciousness. Sudden LOC after a dive is an air embolus until ruled out. The treatment is recompression in a hyperbaric chamber as soon as possible.
Finally, we will discuss indirect effects of pressure. Nitrogen narcosis is a toxic effect of breathing nitrogen-containing gases while at depth. At elevated partial pressures, it has an anesthetic effect. The deeper the dive, the more severe the effects.
Initially, it causes euphoria and hallucinations, but eventually can lead to loss of consciousness. Ascent causes the cessation of symptoms.
Decompression sickness, also known as the bends, occurs when dissolved nitrogen comes out of solution and forms bubbles in the blood and tissues. 98% of cases will present within 24 hours of their dive. It typically involves a single joint or the skin. The joint will be painful but will be neurovascularly intact. The skin will show livedo reticularis.
In serious cases, the spinal cord can be involved and patients will have ascending paralysis. Treatment involves 100% oxygen from a non-rebreather, keeping the patient supine, and transferring to a hyperbaric chamber as soon as possible.
The Divers Alert Network functions essentially like the Poison Control Center. They have a 24-hour emergency hotline that can help guide you through diving emergencies. Enlist their help when managing these patients.
To summarize, in diving emergencies, a social history is extremely important. It is nearly impossible to diagnose these diseases without knowing the patient is a scuba diver.
The treatment of air emboli and decompression sickness is a hyperbaric chamber. Know where the nearest one is to your facility.
Don't forget about the Divers Alert Network. They are there 24 hours a day to help with diving emergency patients and their management.
So that's it for this case.
Send us your comments, suggestions, and cases to theclinicalcorrelation@gmail.com and follow me on Twitter @MDNotified.
And me at EMLLou.
Thanks for listening.